Angelo, what was the need you saw that made you create these town halls?
Well, the Partnership for a Drug-Free New Jersey and Horizon has, over the last 25 years, been working collaboratively to address the issue of substance abuse in the state of New Jersey and really bringing awareness and putting a spotlight on that issue. When we saw that the opiate epidemic was becoming an issue that needed to really be addressed in a very significant way, both groups came together and developed the concept of having a town hall.
Every person in this room, I could almost ask for a show of hands, knows someone, family, friend, colleague, neighbor, who is struggling with this issue.
Jen, a lot of people may be reluctant to attend or even afraid to discuss the topic because there seems to be a stigma around it. So how do the town halls reduce stigma in the community?
Sure. There were several goals for the town halls, including educating and informing our attendees. But one of the main goals was to reduce the stigma by putting a face to those impacted in the community. And I don't think there was one town hall where someone from the audience didn't get up to tell their personal story. And it made everyone realize that there are people in their communities dealing with this same issue.
Angelo, for those who have attended, what did they hear that made a difference in their lives?
Well, I think first and foremost, they learned that they weren't alone. And we had over 31,000 New Jerseyans attend one of our town halls over the last 4 years, both online and in person. And what we found with those individuals were that over 80% of them said that the information that they were provided would really help them in addressing the opiate epidemic in their own families.
Part of that law that was passed several years ago also required a conversation to take place between a prescriber and a patient.
Angela, how have these town halls connected communities and family members with leaders and policymakers, and are there notable speakers?
We were very fortunate over the last 4 or 5 years to be able to attract individuals who were in leadership positions in the state of New Jersey who participated in town halls throughout the state. We had dozens of representatives of law enforcement, from police chief to prosecutors. We were including the Attorney General, who participated not only in his role as a prosecutor prior to becoming Attorney General, but also in his role as Attorney General. We had representatives from the legislature. We had representatives from the medical community that participated, from hospitals and from treatment facilities. We also had people that were involved in prevention. And most importantly, as Jen had mentioned, we had people that were involved in recovery, sharing their stories.
Jen, when people leave your town halls, what do they do differently? And more importantly, what do you hope they're going to do differently?
So we found from the post-survey results that the overwhelming majority of the respondents at each location indicated that they learned a lot about the opioid addiction problem and what is being done in their community. But most importantly, having conversations with their children and other family members, and then knowing what resources are available in their communities.